I'm excited to share it all with you. Here's our update. Colorado continues to look stellar, especially compared to the rest of the country. Colorado looks great. So if you see the trend here, all of our cases overall are getting smaller. Our positivity rate in Colorado is also decreased. So you can see the downward sloping trend here. So of all the tests that are being done, not as many of them are positive. It's a little skewed because the denominator changes also as there are less tests that are done. Obviously this number can become smaller as well, but it's not that, the denominator is not that much smaller. So I do still believe that it's real. Colorado's not all dark brown anymore. It's great. Leadville or Lake County still is dark brown, but there are lots of places now that are not seeing the same kind of incidents that we have seen in weeks and months past. So again, good news. And then hospitalizations, there's a lot of bed availability now in our larger hospital population in bigger cities. So that's not hard to transfer our critically ill patients down to the Front Range anymore, which is a big sigh of relief for those of us in rural hospitals. The death rate in Colorado is also decreasing. We always remember it lags a little bit behind just because people, need to get infected and sick, obviously before they pass away. But the trend still is downward, which is very reassuring, considering, how big that peak was. Our local data is trending downward. You have to remember this is also from the weekend, and so we haven't, this doesn't represent what's happened over the last 3 days. And I can tell you that we had 14 cases the week before. In the past 7 days, there's only been 4. So the graph will look different next week, but we also are experiencing a significant downward trend here in Lake County also. Our positivity rate mirrors what's happening at the state, but it continues to be overall not as high as it was. Overall cases, again, for the math whizzes in the group, you can see our curve is flattening, which is always great as opposed to this, enormous exponential rise that we had here. In hospitalizations, we continue to be able to take care of most of the COVID patients here in Lake County that need to be hospitalized, but there are less of them also. And there have been a couple days here over the past a couple weeks where we haven't had any COVID admissions. We still have patients that are here in the hospital, but not COVID, which is a big departure from what you can see happened in December. So again, an overall reassuring trend that we're not seeing as many people who are sick with COVID that need to be hospitalized. Our summary slide shows that our positivity rate here is still higher compared to the rest of the state, but it is much less than it was. If you remember, it was 20% at one point. So it is trending in a good position, and you'll see that this number next week will be much smaller just because we're not seeing as many cases. I wanted to just refocus for a moment on this number, 10%. So what that tells us as a population is that 10% of us have been infected with COVID and have had experience with the virus. Herd immunity happens when 70% of us have had experience with the virus. So if none of us were to be vaccinated, this number would approach 70% 3 to 4 years from now. And so looking at natural herd immunity, which I hear a lot these days saying, well, you know what, we should just all get natural infection and that's how we'll get our herd immunity, will take a very, very, very long time. If we all get vaccinated and get up to that 70%, that will happen by summer. So 6-7 months from now, we will be at 70% herd immunity if we all get vaccinated. So it is vitally important that we all get vaccinated. Yeah, how many times I can say that. But it's obviously how we're going to get this 9.9% number up as high as we need to so that we can enjoy the benefits of herd immunity. And then of course, my favorite slide still there, it's even months later. Are there questions for me? Let me briefly just outline our vaccine effort. St. Vincent Health and Rocky Mountain Family Practice and the Public Health Department has done a fantastic job. We are far ahead of many other counties, and under the direction of Colleen Nielsen, our Public Health Director, we are doing a great job getting all of the folks who are above that line vaccinated. The governor has made it very clear to us who we can vaccinate and who we can't vaccinate. And so right now we're doing, all the frontline worker, healthcare workers, first responders, and then folks 70 and over. And by Tuesday, we should have all of first vaccines into all of those people's arms for their for that group, which is extraordinary. Again, if you look at our communities around us, they're nowhere close to where we are. So we're doing a great job. And then, of course, the second vaccine happens 29 days from the first. And so by the end of February, we will meet the governor's mandate to have all folks in those groups vaccinated, completely vaccinated. So if you are 70 plus or know someone who is 70 plus who has not been vaccinated, please make sure you reach out to either St. Vincent's Health or Rocky Mountain Family Practice, and we will get you scheduled and get a shot in your arm.
Lisa, excuse me, what are you thinking that under 70s will be vaccinated?
Yeah, so a lot depends on today. As President Biden walks across the stage and changes our vaccine plan. And so none of us really know exactly what that's going to look like. What we are hearing through rumor, and again, it's not been said out loud, but what we are anticipating is that he will release all vaccine. And so all of those vaccines that were saved for the second dose are just going to be pushed out there. And then we'll have really an unlimited supply. We can't move into the next phase until we get vaccine. And so we have to wait for the state to give it to us. So if that happens and we get more vaccine, then we're off and running. And we will go through the tiers that have been described. Josh, do you have that slide that has the tiers on there that shows the phases by chance?
Yeah, I do. It might take me a second to dig it up though.
Sure. So we can go through those, but essentially what you're talking about is the 65 and up crowd, or people with chronic medical conditions is our phase 2. And so we need to get through other frontline workers first, the teachers, the grocery store workers, those folks, and that will be our next effort. And we're hopeful that happens at the beginning of March. And then March, we get their first doses in, and then April. And then starting, the middle of April, then we get to those who have chronic medical conditions. So anybody who is sick or less than, 70 would have the opportunity to have the vaccine next.
And a follow-up question to that, is there any concern that if all the vaccines come out are available now, that there won't be any of the second dosages available?
So there was there was a letter sent out by the governor yesterday because we all asked that question and said, well, wait a minute, what about our second doses? How are we going to know we're going to get them all? And he assured us that his understanding is that Moderna and Pfizer are cranking out vaccine at a rate that is adequate to be able to backfill the second dose.
And I've heard that Johnson & Johnson might be might be near approval for their single dose. So,
yeah. And so, the technology behind the Johnson & Johnson vaccine is different than the mRNA vaccines, and the efficacy is not as high.
Okay.
So it more so resembles a traditional vaccine because that's how it was made. It takes an attenuated virus. So they take COVID, they give it a chemical that prevents it from being infective, and then they make the vaccine out of that.
Okay.
Those vaccines, the traditional vaccines like, the flu vaccine and every other vaccine that we've ever made, are less effective. And so, yes, that one will come online soon, but we probably, and again, I'm just, speaking from my own opinion, we will probably use that vaccine for people who are lower risk. because if it's not, if it only has, if it's 70% efficacious, which is still amazing for a vaccine, it may be a better choice to now begin to segregate populations where we put high risk folks in one group and they get the highly efficacious vaccine, and then the lower risk groups maybe get others. But again, it all depends at 12:01 today.
Yeah.
We'll hopefully get some more direction from our president to see which direction we're going.
Thank you so much.
And so this is the slide. And
Lisa.
so right now, by the end of February, we will have everybody above the line done. That dotted line.
Lisa,
there.
is there any data coming out about the like a single shot efficacy for like the Moderna and
Yeah.
Pfizer?
Yeah.
What's like the percentage of that?
Yeah, and so that's actually part of the post phase 3 trial data, and it's about 50% with one vaccine, 94.5% with 2 vaccines.
Thank you.
Yes, sir. Great. I am doing a vaccine presentation to the Spanish-speaking population tonight during a town hall. So if you'd like to tune in for that, it is what I call my dog and pony show, which goes over how the vaccine was made, why it is safe, and then why you should take the vaccine and how efficacious it is. And that will be done via Zoom as well.